Hi, my name is Katie Bright, and I'm part of the Family Nurse Practitioner Program. The topic that my poster focuses on is concussions among the pediatric population and how to properly treat them to attain the most successful outcomes. According to the CDC, concussions are classified as a traumatic brain injury that affects how the brain functions, and they have a wide range of symptoms that can be short-term or long-term, including changes in thinking, sensation, language, and emotion. Repeated concussions over an extended period of time can result in several neurological and cognitive deficits, while repeated concussions in a short period of time can be fatal. With organized sports on the rise, the number of concussions occurring among youth is increasing. Concussions are one of the most difficult athletic injuries to diagnose and manage due to the variations in clinical presentation. Because of this, concussions are often overlooked, and proper diagnosis and subsequent treatment and recovery get pushed aside. With no gold standard for the diagnosis, physical and cognitive rest has been recommended after sports-related concussion to reduce the potential for a repeat injury while the brain is still vulnerable from the initial concussion. But recent studies have shown positive outcomes when light activity is utilized in the acute phase of recovery and has shown to speed up symptom recovery, decrease feelings of depression, and allow the child to continue their normal routine as much as possible. When you think about it, any other athletic injury that occurs utilizes rest very early on but incorporates activity into their plan of care. For example, if someone tears their ACL or has to have shoulder surgery or rolls their ankle, PT is always utilized to maximize recovery and strengthen the injured body part. So the purpose of this project is to implement light cognitive and physical activity into the care plan of pediatric patients who have suffered from a concussion to see if they have a quicker recovery with less symptoms than those who follow a care plan recommending strict rest. Since most concussions are treated outpatient, this project is directed towards those working in pediatric emergency departments, pediatrician offices, and urgent cares and clinics. This is significant to the nurse practitioner due to the rise in concussions among pediatric patients. It is important that as future NPs, we recognize the signs and symptoms of concussions and have the knowledge to properly diagnose and treat. This will allow the NP to find the most beneficial care plan and allow patients to have the safest recovery with positive outcomes. So for the synthesis of the relevant literature used across all studies, an initial rest period proved to be helpful in the recovery process and decreased symptoms in a shorter period of time. But it also showed that too much rest could actually be detrimental to recovery and prolong symptoms. Due to the fact that there is no gold standard for treatment among youth suffering from concussions, a vague care plan was a finding in all of the studies and provided no specific time frame about when it is okay to return to normal activity. All studies slowly progressed activity once symptoms subsided. Differences in the studies included the care plan that was prescribed. All 4 studies used different methods to collect data, but they all included adequate sample sizes, reliable measurement tools, and were all applicable to patient care in outpatient settings. Weaknesses were included within the limitations, and all of the studies and actions were taken to minimize them. Gaps in the literature included guidelines on how to prescribe and monitor active rehab safely, an effective length for an initial rest period, and strict guidelines on returning to activity. So for the proposed intervention plan, an interprofessional team would be recruited to participate and will include coaches and school nurses so they are prepared to immediately pull the child from play and send them either to the ED or their primary care provider. Others will include those working in pediatric emergency departments, pediatrician offices, and then any kind of urgent care clinic, as well as those who have conducted research supporting positive outcomes for this study. Prior to implementing the plan, the team will meet weekly for 1 month to determine everyone's roles and to solidify the exact plan in order to successfully roll out the proposal. The NPs are responsible for determining the child's plan of care as well as setting up regular interval checkups either by phone, in office, or by providing an online questionnaire to monitor the patient's current symptoms and find out what their current level, type, and frequency of activity is. Based on their symptoms, the NP will progress the patient's activity slowly until they are back to normal level with no symptoms present. Once the plan is implemented, quarterly meetings would be appropriate to share outcomes and experience that they have had with their patients, as well as any problems or any changes that have arose or need to be made. These meetings will continue until an adequate amount of patients have been treated and enough data have been collected to determine how well the proposed plan of care works. So there are several ways that the nurse practitioner can evaluate the patient other than just looking at the presence of symptoms. The SCAT5 screening tool that I mentioned on my poster and in my paper provides a standardized way to evaluate several aspects of the patient. A cognitive screening test that consists of orientation questions and immediate memory testing is also included, that has the patient say 5 words and has them immediately repeat them, and then a concentration screening such as saying numbers and having the patient repeat them backwards can also be done. A neurological section is included in the SCAT-5, which consists of a balance exam, and then simple coordination tests can also be done. Other tests that are included are things such as the delayed recall test, which has the patient try to remember the list of words they were asked to say earlier and repeat them. And the SCAT-5 provides improved guidelines for healthcare providers when evaluating their patients and allows the healthcare provider to monitor the trends of the patient's scores to see if they're consistently improving with the prescribed plan of care. Since concussion symptoms can be changed over time and don't always appear at the time of injury, it is important to re-evaluate and repeat the SCAT-5. Concussions can be a dangerous injury that must be taken seriously, so hopefully this presentation allowed you to see the importance of having a child evaluated by a medical professional after a head injury occurs and have them prescribed a plan of care that can be followed, as well as the importance of being familiar with concussion treatment as future NPs. Thank you.